All right, hello everyone, and welcome to the Encephalitis Podcast. Today we'll be talking about the challenges that low to middle income countries face when it comes to encephalitis. To find out more about this important global issue, I am honored and grateful to be joined by Dr. Gareth Lipunga. Dr. Lipunga is a medical doctor trained at the University of Malawi's College of Medicine with a postgraduate MSc in Integrated Immunology from the University of Oxford. He is currently pursuing his diploma in tropical medicine and hygiene with the University of Glasgow. He has a keen interest in clinical research and internal medicine as a future speciality, with a focus on infectious diseases. He has worked as a junior doctor at the Queen Elizabeth Central Hospital in Blantyre and is now based at the Malawi Liverpool Wellcome Research Programme as a study physician conducting vaccine research using controlled human infection models. He has previously worked alongside the Brain Infections Global Project, focusing on neurological infections in Malawi. Dr. Lipunga, thank you so much for joining us today. How are you?
I'm good. Thanks. Thanks for having me on this podcast.
Thanks for being here. So shall we start with your own story about how you became interested in encephalitis, and then we'll go from there.
Sure. So, as you said in the intro, I did my medicine undergrad here in Malawi and did my internship at the Queen Elizabeth Central Hospital. So during that time, especially living in the tropics, I largely became exposed to a lot of infectious diseases in terms of the cases that we dealt with, and I did see a lot of brain infections within the ward and within the practice. And within a few months after completing my internship, that's when I joined the brain infections group, which is headed by Professor Tom Solomon. And I was the study coordinator here in Malawi at the time. So I always did understand that brain infections were a problem, but I think the more I delved into the research with the group is when I realized that one of the fundamental problems within our setting, especially in low middle income countries, tends to be the diagnostics and the management. And we have this thing where we empirically um, investigate and diagnose brain infections. And what that just means is if a patient has specific symptoms like fevers or seizures or are comatose together, you can broadly speculate that this might be a brain infection. So it might be a meningitis, might be an encephalitis. So delving a lot into the research showed me that investigating brain infections, especially encephalitis, can be a problem and can cause a lot of delays, especially within our setting, and can affect management. So that's when my interest began. Yep.
All right. Okay. So really, there's a kind of a discrepancy in diagnostics and management in low income compared to higher income settings.
Yes.
Um, can you go into specifics about like the management side, for example?
Right. So the management side, I think what makes it tricky sometimes is because brain infections are, it is quite serious, it is quite severe. If left untreated, you do need to act promptly. Now, there's multiple uh, bugs and pathogens that can cause a brain infection, and especially when you're looking at encephalitis, there's lots of different viruses that can cause. Now, if you are struggling to identify which specific microorganism is causing the sickness or the syndrome in this specific patient, it then becomes challenging to appropriately choose the right antibiotic or antiviral in this case to treat the patient. So what ends up happening is that you can end up giving lots of different medication, but not really specifically destroying the bug that is causing the sickness in the first place. So the sickness can get prolonged. So I think one of the challenges is choosing the appropriate care of management. Within our setting, we can diagnose bacterial infections. So we have a lab that is able to detect different pathogens on CSF. Um, but I guess in terms of viral illnesses, where you use a different subset of molecular testing, that is still a challenge. We do have some capacity within the more tertiary centers. However, in the wider public health sector setting, such as the district hospitals, this can be a challenge. So in Malawi, I think something worth noting is a lot of the healthcare system is funded by the government and is not privately owned. And as such, you can come across some of these challenges where certain diagnostic tools are not available, which then affects the management, therefore. Yeah.
All right. And so you talked about diagnostic tools and you mentioned particularly viral testing. Can you go into more specifics about what is not available?
Right. So it's largely molecular testing. So if I take it back to bacterial testing, where you can culture either on cerebrospinal fluid, which is the fluid that surrounds the brain, or you can also do culture testing in blood. That is available in some tertiary hospitals. However, when you look at viral, the way you detect viruses within human fluid is through polymerase chain reaction, so PCR tests, right? Where it's a bit of a complex process, but those mechanisms and those tools are not available within most public health settings. So as a result, if a patient comes with, as I said, a fever, a headache, comatose, or having some sort of neurological sign, you do broadly know that this is a brain infection, but you may not be able to tell, just off the batch that this is this specific virus that is causing that. So as a result, I think, as I mentioned before, you just tend to treat broadly. And I think maybe just one more thing that is very unique, especially within our setting in Malawi, is malaria is very endemic. So you can sometimes, although it has gotten better, you can sometimes overtreat for malaria, just in case it's not a malaria syndrome that is causing the neurological symptoms. Yeah.
Right. Um, all right. Thank you so much. Let's move on to in your experience, how do cultural social factors influence when people seek medical help in such settings?
Right. So, for instance, with an encephalitis, as I said, it's something that largely affects the brain. So symptoms to expect are symptoms that affect their neurological system. So they might be things like comatose, confusion. There might be some degree of psychosis as well. There might be seizures. Now, these four things are important because, particularly if a patient has some degree of confusion, um, one might misinterpret what is going on to be a psychiatric illness. And I think this is global. It's not just unique to Malawi. Within encephalitis, there can be crossover between pure neurology and psychiatry as well. And there's an overlap between the two systems and the two worlds. Now, within our setting, some of the cultural factors that do affect symptoms that do suggest a psychiatric illness also do affect the management process. And what I mean by that is some communities may believe that maybe there is you know, other factors, to put it simply, that are affecting the patient. So not just an organic virus, but maybe beliefs of spirits, for instance, that something which needs religious intervention is going on. So because some of those cultural things might affect the way, a family may approach the patient who has these symptoms, the first point of contact sometimes may not always be the hospital. It may be through other means to help the patient. So that can cause delays. Secondly, by cultural, I did mention that within our setting, malaria is endemic, and malaria has improved, but it's still there. And if somebody does have a fever, the first thing to think about sometimes, especially within our context, is, does this person have malaria? So I think we're very good at spotting malaria. We're very good at treating malaria when we see it. However, it's also worth considering other diagnoses such as encephalitis. So in the process, you can miss out on encephalitis with the intention of trying to treat something that you can treat, like malaria. So those are some of the factors that can influence. But I think by and large, there has been more awareness and more education amongst different communities, where if they do note that, so for example, within the more rural sides of Malawi, you have what you call health surveillance assistants who educate communities on what to look for, danger signs, safety netting, when to take a sick patient to the hospital. And the hospitals do have systems as well to refer patients to appropriate centers where they can get testing done. Yeah.
That's an incredible initiative to have people like that in such remote villages.
Yeah.
Amazing. Um, have you ever witnessed stigmatization of people affected by encephalitis?
So I've never witnessed it personally, firsthand. However, I mean, speaking from the perspective of having also worked with patients who do have a psychiatric illness, of which that can also be part of the broader picture of an encephalitis episode or disease process. I do know that patients can also get stigma in that context. So I can imagine that within our setting, um, somebody who's maybe suffering from more long-term effects of encephalitis may experience some degree of stigma within their families, within their community members. So I think there is a great deal of, I think I've seen some of the work that the Encephalitis Society has done. And I think during one of my visits with the society, one thing that really was very clear to me is that in the management of encephalitis, it is really a multidisciplinary approach where it's not just the in-hospital aspect of clinicians, nurses, doctors, it's everybody. It's the families, it's it's the radiology department, it's everything in hospital and everything outside of hospital to manage the holistic aspect of the patient. So yes, I do believe that there can be stigma within our setting and elsewhere as well. But I think if we do hone in on the holistic, multidisciplinary approach, we can help to advocate for our patients. Yeah.
Absolutely, yeah. It's so important to have that multidisciplinary approach.
Yeah.
And could you perhaps share a case that stands out to you in that illustrates the challenges of treating encephalitis in Malawi?
Yeah, no, that's true. So this is not a case that I dealt with directly myself, but colleagues within the world of pediatrics have seen cases where a child may have HSV encephalitis, where HSV stands for herpes simplex virus, and typically such patients tend to dwindle over time slowly and become comatose, have fevers, and it's quite similar to cerebral malaria, which is also something that's quite common. However, the only difference is that when you do the blood tests, you will not see the parasitemia of malaria in that case. So one of the challenges that was encountered is to get imaging. So just to give you context, within our setting here, we have 2 CT scans within the southern region of Malawi that cater to the health system. So that's both in public hospitals as well as private hospitals. So imaging can be very important as well to try and define whether this is an encephalitis. That's the first thing. The second thing was to get the right medication for the patient. So in this case, it would be a cyclovir, which is an antiviral med, which is best given intravenously. However, with that treatment, you need about 3 to 5 ampules, vials of the drug per day. And within our context, it costs about, well, this was maybe 3, 4 years ago, it costed about 21,000 per vial, which to the pound equivalent, that might be, 4 or 5 pounds, or maybe 8 pounds, which it may not seem like a lot of money, but for the average Malawian come from the rural area, that is quite a considerable amount of money. And because this was not available within the pharmacy at the time, usually we ask families to then get that medication and to procure it So that can be a challenge. And what was only available was the oral, which, as we know, is not effective in getting to the brain itself to help to kill the virus. So in such cases, you find that diagnosing is a challenge. Secondly, you also find that getting the adequate treatment is also a challenge. And as such, you can get poor outcomes, you know, because of certain aspects that are not readily available. But I think the team was aware that this is a case of encephalitis. However, due to, I guess, a challenge in resources, it was difficult to, to really manage in the fullest of sense. So.
All right. Well, thank you for sharing that case with us. Moving on to kind of like on a brighter note, what aspects of encephalitis care have improved in Malawi over the years?
So I think going back to, I guess you can look at it from two perspectives. So the in-hospital perspective and the outside hospital perspective. So for the in-hospital perspective, we have a very robust team of different clinicians across different disciplines who are able to identify the case and the condition quite promptly. I mean, before we only had one MRI machine within the tertiary center that I'm based at, but now there's been the introduction of a CT scan as well. So we've got more imaging modalities to help to identify some of these different cases that do affect the brain. And I think broadly speaking, there is a lot more awareness for encephalitis, as well as other brain infections that affect different patients. And I think even within the broader community level, people are aware, and I think this goes to clinicians as well. Everybody is aware that fever does not equal to malaria. And I think that's something I keep on having to stress because we've always known malaria to be, a big killer when it comes to infectious diseases. However, that's been managed very well. I think we've reached some of the milestones for our own country in managing malaria. So now it's like, okay, let's think about other things that might be causing this fever. Let's think of other things that might be causing neurology. And I think there's talks in future of establishing more diagnostic tools and diagnostic pathways to be able to identify some of these different pathogens. And the Brain Infections Global Group had this program from 2019 to 2022 to 2023, where we were then able to also go into all the different districts, both for the primary care centers as well as the tertiary care centers. And we did a lot of different workshops and education initiatives. We've also had 2 neurological infectious disease courses over the past 3 years where we've been able to, get the experts in country, get some experts outside country, and talk about encephalitis, talk about different brain infections, and just raising the awareness. So I think there's been a lot more awareness that's been going on. Yeah.
That's amazing. That long-term work is so important in terms of education. And I'm so happy to hear about the CT scan. I think imaging was one of the things you mentioned being a problem, and
Yeah.
that's so good that's being addressed. So what message would you like to share with encephalitis, people affected by encephalitis in other low to middle income countries who might be watching this podcast?
Yeah. With encephalitis, I think the first thing to realize is there's always hope in terms of care. It's a community, it's a community thing where all of us, whether we have family members with encephalitis, whether we ourselves have encephalitis, whether we know someone with encephalitis, everybody can do something to raise awareness and that there are people who have overcome it. And if it's a situation that you're currently in, trying to, get the different medical care as well as some of the social care beyond the hospital, there is hope and there's a lot of patients. And I think speaking about the Encephalitis Society, There's a lot of testament of different people who have had encephalitis and have overcome the stigma as well and the disease itself. So there's always a beacon of hope. Yeah.
That's lovely. Thank you. Yeah, I think we basically come towards the end of the podcast. Before we finish, is there anything that we haven't discussed, perhaps that you'd like to mention to do with low to middle income countries and their particular challenges?
Not that I can think of immediately. But I think we covered most of it, which is diagnostics, management, awareness. Yeah, yeah.
Yeah, and education as well.
Education,
Um,
yeah.
yeah, yeah, I think that's yeah. Well, thank you so much. I think we've come to the end of this podcast with Dr. Lipunga. I would like to thank Dr. Lipunga for sharing his valuable time with us. Thank you so much.
Thank you for having me. Thank you.
And finally, I'd like to thank you, the listener, for listening/watching. We hope you have found this episode of the Encephalitis podcast helpful. Encephalitis International is here to help and support in whatever way we can. For more information, as well as our contact details, please visit our website, www.encephalitis.info. And together, we can achieve our aim of ending death and disability from encephalitis. You can also find all the information you need in the podcast description. As always, if you can support our work, we would be extremely grateful. Please visit www.encephalitis.info/donate. Thank you again, and see you next time on the Encephalitis podcast. Bye bye.